Good morning. I'm joining you from our main office in Sacramento, California, and I'd like to welcome every one of you for our monthly webinar. We are still waiting for everyone to join, and Dr. Montalvo to join. Let me see. Just to remind everyone about our raffle. So you need to have a health questionnaire filled out with us in and if you have filled out an HQ before, it's okay. You don't have to redo it unless it's more than 3 months old. You can go to mexicobariatriccenter.com/health-questionnaire, and that's where you can find the form if you haven't filled out one, and select Dr. Montalvo. If you have, again, submitted the HQ before, we can still enter you in the raffle, and make sure you stick around and be there until the end of the webinar to be eligible to enter our $2,000 off of surgery package raffle. So again, we do this webinar every Saturday of the month, and we rotate our surgeon. Today we have pleasure to have Dr. Montalvo with me. Okay, so people who just joining, please make sure you have a health questionnaire form filled out in our site, and enter to be able to enter the raffle, which we do at the end of the webinar. You need to be present for the whole duration of this webinar. And that's all it takes. Have HQ and be present in our webinar presentation. So okay, so we're going to get started here. Dr. Montalvo is going to join us shortly. First of all, my name is Ron Ellie. I'm the founder and CEO of Mexico Bariatric Center, MBC. I started being in the medical tourism industry in 2007, and MBC started in 2012. So we have over 12 years and over 20,000 surgeries behind us. We will try to cover the most questions that people ask, frequently asked questions during our presentation. So we would like you to pay attention so we don't have to repeat that again at the end. And you get a chance to ask questions in our Q&A, which is again is at the end of the presentation. You get to we get to answer your questions, whether it's travel related or medical related. As far as so we try to limit this to under 2 hours, but again, there are some questions sometimes that we don't get into, so you can reach back out to us, and we can answer that. We'll be more than happy to answer that. So the topics that we are covering today is basically about obesity and being overweight, risks of obesity, weight loss surgery as a definitive answer to cure obesity and its related medical conditions, and talk about MBC. What does that MBC do? And we talk about, at that time, Dr. Montalvo is going to take over and talk about laparoscopic and endoscopic procedures, all the procedures that we offer. We offer a wide range of bariatric procedures. And then we talk about the crucial role of bariatric vitamins in your recovery and long-term success. Then we have the Q&A session. Like I said, you can ask your questions in the Q&A tab. We get to it at the end. And then we do the raffle at the very end of our presentation. So we all know what obesity is. Obesity is basically becoming a worldwide problem and epidemic, and really is a metabolic disease. And of course, you know, our genetics, our developmental history, our lifestyle, all these are contributing to this problem. And the fact that we're living in an era that there are so many conveniences and daily activity is limited, and we are bombarded by sugary drinks, ultra processed food, fast food, and these are all taking a toll on us daily. In the medical field, there is a term called body mass index, or BMI, which pretty much everyone is familiar, and it's just basically a formula that you enter your height and weight, and it gives you a number, and that number basically puts you in a chart that is categorized based on less than 25 BMI, which is called normal in the green area. And then you start becoming overweight from 25 to 30 BMI. And then after that, it's called BMI of more than 30 is obese. And then obesity can be, again, subcategorized to morbidly obese, super morbidly obese, super morbidly obese. One thing that you would hear is the amount of the capabilities of our surgical teams, that they can handle not only so many different type of surgeries, we can offer you no limit of what BMI we can operate on. We have operated BMI of over 110 in our center before. So we talked about this already, you know, the ultra-processed food, lack of physical activity, comfort eating, stress eating. We all, a lot of us are lacking of sleep, inadequate sleep. And then some of us taking weight gaining drugs. That's Dr. Montalvo. Good morning. Hello, how are you? Nice to have you. Yeah, I'm just going over the slides. Yes, so as we gain weight, not only are fat cells or adipose tissues increased in numbers, they also change in structure. And that's something that was ignored before, right? So the way to explain the insensitivity to leptin, insulin, all that is explained now by structural change of adipose tissues or fat tissues. And then on the right of your screen, you see there are two images, one on the top, which shows the obese adipose tissues, and the bottom one shows the lean adipose tissues, and you see how the structures change. Structural change is causing all the problem, the underlying medical conditions. In US alone, 40% of adults are categorized as obese. And I always show this animation to show what happens when we gain fat in the abdomen.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
Yes, so I always share that video. It's a very simple, short video to show, the changes on the function of your lungs. It changes it puts pressure on all the body parts. Your heart gets affected. Diabetes type 2, which is very familiar, we're all very familiar with that, when your A1C goes up. And hidden consequences of obesity, such as kidney disease. We always worry about our heart, but kidney can be a huge factor in our well-being, and obesity can cause chronic kidney disease. And these are the, kidney disease can be, basically cause death in a very short time. So during the COVID, also coronavirus, we found out that, hey, obesity is also a negative factor in catching the virus and be affected by it, ending up in ICU. And finally, it caused more death in people who had high BMI. And the reason, again, is because there are more fat cells, and the coronavirus attaches itself to the fat cells. So the more fat cells you have, the more possibility of catching it and being affected by it. So now that we kind of went over, okay, what's obesity? What is the cure for obesity? After pandemic, we found out that we really need to trim down. We need to keep a healthy lifestyle, watch our diet, be active, make sure we do, walk, go to the gym, exercise. But again, diet and exercise alone has not shown a permanent long-term solution for obesity. So it is a great idea to do watch your diet and do exercise, but is not a long-term solution. And then these diet pills or medicines that from the beginning of human history, we've been looking to find a magic medicine to take care of our weight. And that has also proven not a long-term solution. We would talk about Ozempic-like medications or injections, which is crowding the market. We could talk about that a little later. But again, at this point, still bariatrics is the king of curing obesity. It's quick, it's safe, and is long-term, is sustainable weight loss. So we would cover that. So diet and exercise. Once we go on extreme diet, our body is going to react by decreasing our metabolism, increasing our hunger, and our satiety goes down. And this is how we can basically explain how the bariatric surgery is a sustainable, quick, and safe solution. Like I mentioned, obesity is a metabolic disease. And what bariatric surgery does, it's resetting your metabolic system. And that's why it's like a magic. It's like, the minute you wake up from your surgery, your body sees you at a different set point. And again, remember that our weight is basically brain and gut hormones, right? So we have these hormones, mostly in your gut, that is interacting with the brain and is setting your metabolic system. So let's say this on the right of my screen, if a person who weighs 250 and is overweight, the body is interacting around 250 pounds and your brain sees you at 250 pounds. Now, let's say this individual does boot camp type of exercise and extreme diet and manages to go down to 175 pounds. So he loses 75 pounds by diet and exercise, but brain still is used to see you at the 250 metabolic thermostat. So what is it going to do? Like we saw in the previous slide, your hunger goes up or metabolism goes down. Your satiety goes down. So it's trying to take you back to the weight you were. So you're always resisting, like your body is resisting to get you back. Now, when you do the bariatric surgery, right after you wake up from the operation, because of the hormonal changes, the gut hormone is interacting with your brain. Now is a different set. It's a different set point, and that set point is, let's say, is 175 pounds. So what happens is your brain and your gut is interacting around the 175 pounds now. All of a sudden, your set point is changed. So bariatric surgery resets your metabolic set point. And that's why your hunger goes down and metabolism goes up right away. You won't be as hungry and you burn fat. Quick, fast, safe, long-term. That's the magic. That's the explanation. Okay, so we talked about medications. Okay, the pharmaceuticals. Medications, over time has been the pharmaceuticals have tried to come up with this magic pill. Of course, Ozempic and Ozempic-like injections like Wegovy, Mounjaro, Zepbound, these are really great drugs and is a revolution. However, you have to see the pros and cons. So they're basically trying to imitate some of the hormones that are naturally occurring in the bariatric surgery. So also, you see the side effects. If you have thyroid, you cannot take it. It can cause thyroid tumors. It can cause pancreas problem, vision problem, gastric paralysis. That's really common. And the other fact, again, you're putting hormones that your body doesn't need to imitate a naturally occurring hormone that comes from changing your intestine and changing your stomach configuration. And this, you have to keep taking it. It's expensive. Usually the insurance doesn't cover. And some people doesn't work for them, but you have to pay and keep taking it to lose weight. So it's not permanent. We like to talk about this pyramid of how effective different solutions are, right? So we talked about diet and exercise. Maybe 3 to 5% of the population are successful by doing diet and exercise, reducing their weight. Semaglutide, like we talked about, Ozempic, Wegovy, Mounjaro. And then there is a category that has come up recently, again, like gastric balloon, endo sleeve, we do Orbera and SPATS-3, which SPATS-3 recently got approved by FDA in US. And then it comes the gold standard, which is sleeve, bypass, duodenal switch, all the bariatric operations that actually changes your hormones and make you successful in losing weight fast, safe, and durable. This operation is very costly because the instrumentation is used, because of the fact, of course, we talk about that shortly. So insurance usually doesn't like to cover because it's costly for them. They would rather for you to take medication and, have joint problem, have kidney problem, have heart problem, and then just put you on those medications again. So that's the deal. And so if you're underinsured or uninsured, medical tourism, hooking up with the right company to go get this procedure abroad is the option. This is your last resort, and we are your last resort. And CDC recommends the companies like NBC because we manage your travel, your maneuvers down there, pick up, drop off, hotel. We have the best team of surgeons. It's not just one surgeon that only can do one type of surgery. And we offer so many pluses that we will see when we talk about why NBC, that why we are the choice. And again, this is just a highlight, the bariatric surgeons that we have. We work with over 10 years of experience, our reviews, our treatment of patients from the time they get in, from the time they leave. And, social media is a curse. It can be great tool for people, knowing about things, but also it can be deceitful because, some of the individual surgeons or whatever, they just put a TikTok video or Instagram, put bunch of pictures which you don't know where you come from, and then that shows that they're legit, where there is no structure or organization behind this. This is just a page. This is just a bunch of pictures. You need to see who is the surgeon. We could talk about, for example, the surgeon expertise here. Okay, so I like to always compare the experience of surgeons to pilots. Do you want to fly? Would you be comfortable or feel safe to fly with a pilot that has maybe 20 or 5,000 hours of flight time? Or would you rather be with a pilot that has 50,000 or more hours of flight time? This is the deal. When you go to these companies and you don't know who is doing your surgery, first of all, I see that often. There's a face, but that's not the surgeon who is doing your surgery. Underneath, there's somebody else, less experienced, is doing it. And most of the time, it goes well, but not always. Not always. That's why you need an experienced surgeon who is not only the face who is doing the surgery, also is the surgeon who is going to lead that operation. So this is huge. And again, in the TikTok and Instagram and even website, you don't know what is that you're getting into. And unfortunately, it's been always a competition on price. They keep dropping the prices because, first of all, they don't have the quality that we offer. And then the second of all, you don't know what their ultimate goal is. We've been here before in the past, we're here today, we'll be here tomorrow. We are one of the longest lasting company that is doing this. And the amount of expertise we have from top to bottom is not touchable with any company. So price is really, I mean, our price is one of the lowest, but the price shouldn't be the determining factor. You have to look at what you're getting with what company. Again, MBC is a US corporation. We have pushed our standards of excellence in US to Mexico. And we've been committed to patients since inception to provide high quality VIP treatment with the most affordable prices out there. And this is what you're getting coming with MBC. We set standards of medical tourism pretty much in Mexico and probably worldwide. Everyone has been and is following us and imitating us. So these are the highlights of why you would choose us over any other company. So, we talked about some of them, mainly the surgeons, we have the youngest, most experienced laparoscopic bariatric surgeons who are certified for this in probably North America. You're getting a quality of service that meets and exceeds US standards. And the support you're getting is not touchable. The nutritional support, the before surgery support, the after surgery support, the team we have is experienced coordinators, experienced people who have been working with you guys for over 12 years. And our vision has been always to provide the most quality for the prices that you pay. And Hospital Azar is an indication of commitment to safety and quality and healthcare and medical care for our patients coming to us. This project started in 2021. I always had the vision of providing top quality services from US to Mexico, and this is the project that is almost about to start. And we have pretty much gone a route that again is going to set standards for US and Mexico. I'm sorry. So this hospital has 4 ORs, everything from the patient's room, a spacious patient's rooms, convenient. You have great views, and we have ensuite X-ray lab. So this is a step up in the medical tourism industry, and everything is state of the art, advanced, and all the OR tables are the best in the industry right now. That we have purchased all the facility equipment, all the best of the best, and so we are working toward opening soon. This is a picture of early on when Dr. Valenzuela was visiting us. That was a framing stage of the project. And we talked about, our years in business, in type of surgeries we do, the type of surgical teams that we work with, our all-inclusive packages. These are like VIP concierge packages that you get to have all that is needed in one package. And it's not like US pretty much everything is outpatient. It's like we keep patients in the hospital to make sure, they are recovered well. And for sleep, we keep them 2 nights. These are like, if you were to do this in US, just every night alone in the hospital would cost you 4,000. And the way we have built Hospital Ozar is up to the international codes. So you're getting a facility that is better than US or the same quality as US. And we're not shortcutting our package. So imagine just staying 2 nights or 3 nights in the hospital in US would cost you about $8,000 to $12,000 just alone. The instruments that the surgeons use, those are all high-end that are very costly too. So if you add this up, our packages under 5,000 is the deal of the century. Our process is very simple. We don't give you a runaround. You just do the health questionnaire, like I asked you at the beginning of the webinar to fill out. You can even do these online. So you can do the HQ, wait to get approved, and go online, pay the deposit, and get booked. But you can always do this with our coordinators in our office. And you just basically complete your paperwork, you arrange for your travel, and whether you drive or fly, from the time you get to San Diego, we pick you up, we take you, do all the necessary pre-ops, hotel, hospital, post-op care, and we bring you back. And support, again, is one of the biggest features of being with us, is the aftercare support. One of them is Facebook groups. the Facebook groups. We have few of them, and one which is our the biggest one is our past patients. Again, is over 10,000 people, I mean individuals that had surgery with us, and this is where you can get, you know, information before and after surgery, see how people have succeeded, their before after pictures. Basically, they would guide you to become successful. Also, another highlight of our services is our past patients working with us. These are people who are day in, day out, are working with us to support you. And our affiliate, you know, Sarita, she's mostly on Facebook. Um, Rena, Dawn, Kelly, Jamie, these are just helping us, our affiliates, to do a better job for you guys. And for example, Rena, I mean, look at her before and after. She's amazing. Again, they do a podcast, Serena and Rena do, which is very useful. We're talking about how does it work. So you basically fly to San Diego International Airport, which has two terminals. One of them, Terminal 1, is under construction. So hopefully in a few years it will be done. But we want you to arrive before noon. That gives us enough time to cross you. It's about 30 minutes from the airport to our facilities. And then we do your pre-op, we take you to hotel. Right now we're using Hyatt mainly. And you stay there the night of your arrival. And then you do the surgery. They do the surgery for you. They tell you what time to show up to take you to the hospital. And then after you're done, we want you to have your flight be around 2 p.m. That's an ideal time. So you have enough time to cross the border. And at the same time, you won't be waiting in the airport too long. You know, again, for people who joined us a little later, we want you to have a HQ in our system. If you have filled out one before, it's great. And if not, do one. Dr. Montalvo should be the surgeon of your choice, because this raffle is for Dr. Montalvo only and specifically. We want you to attend the webinar to the end, and then we do the raffle after Q&A session. I was talking about the team of surgeons we work with. This is the exclusive network of best bariatric surgeons in Mexico. And again, if you look at how young they are and how great they are and how experienced they are, you won't find a team like that anywhere, at least in North or South America. So Dr. Montalvo, which we have a pleasure to have him today, Dr. Valenzuela, Dr. Gutierrez, Dr. Rodriguez, Dr. Usuna. Dr. Usuna, by the way, works half-time in Tijuana and half-time in Guadalajara, and Dr. Jesus Ceja. This is the way we handle every HQ coming in. So it goes through our surgeon liaison. She's a medical doctor, bilingual, that checks every single HQ approved. And then the patient's HQ is again matched against the best expertise of the surgeon. So we match the HQ with who is the most qualified surgeon to do your type of surgery for your BMI or your what is best type of option for you. All that is matched between you and the surgeon. So that surgeon gets your HQ, they review it. Once it's approved or not, it goes through surgeon liaison. Patient coordinators and dietitian are also in sync with all this, back and forth flow. That's what you get coming from us. Our pre-op diet is very simple. Depend on your BMI, you may need a very simple 2-day clear liquid, 2 few weeks of pre-op diet, and just basically pre-op diet, all it is low carb, high protein diet. So you just, the better job you do on the pre-op diet, the easier the surgery is on you and the surgeon. We talked about our surgical expertise and hotel. Hyatt is the one we're using right now. You'll be instructed if you're taking medications or if what medication to take or not to take. In general, you shouldn't take any blood thinners 1 week before the surgery, and stop NSAIDs like Advil and any over-the-counter medications like that. And then again, just comply with the surgeon's instructions of what to take and what not to take. However, if you're taking a medication on a regular basis, please bring the bottles with you with the label. Pre-op, just stay in the comfortable Hyatt and enjoy your stay the night before surgery. We provide Jello, broth, and your companion stays with you if you bring a companion, and they can have the free breakfast at Hyatt. On the day of surgery, you get picked up, you go to the hospital, you get the surgery, make sure you walk as soon as you can. And we do the post-op test. We do several post-op tests. One of them is the fluoroscopy, which you drink that not so fun stuff, and we do the x-ray. You stay there 1, 2, 3 nights, depends if it's a gastric balloon, sleeve, or bypass, or DS, and you be on your way to go back home. If you're driving, you be parked, probably better deal is to park around, one of the airport parkings and take the shuttle, go to the terminal and get picked up. So one of the ingredient or the recipe for success has been our surgeon's load management. As I mentioned, if you're like a one doctor, right? So you have to do some surgeries more some days, so less some days is your business. Now you just can't manage it because you have to do as much patients they come. But we don't have that limitation because we have 6 teams of surgeons. So we do what we call a load management system. So we monitor the maximum amount of surgery that each surgeon can do on a daily basis. And we give them the weekends off. We let them take vacations. So they're well-rested surgeons. And this is one of the reasons that our complication rate is less than 1%. And those 1% complications are really like maybe you get infection in the wound and the incisions, or like very simple things. Or the most difficult one is bleeding. That, of course, when you're there, you're under surveillance. We pull you right into the surgery room and stop the bleeding. So these are all caveats of what you should expect. Now, we have not lost any patients over all this time in the OR table. But I would highly recommend you look at the surgeon you pick, your company you pick, because if the surgeon is not experienced, again, most of the time there is no problem. But also remember, it could cause death. And also, we talk about, okay, so it's a gastric sleeve. Not every surgeon uses the same technique to do the gastric sleeve. So the outcome is not going to be the same. So you want to be with a surgeon that has the most experience to do the surgery, not only at the lowest complication rate and lowest risk, also the highest outcome, because outcome comes from the surgeon's experience. Now, these are the options we offering in general. Again, I mentioned laparoscopic versus endoscopic. Laparoscopic surgeries like band, which we don't recommend, but we could do it. Gastric sleeve, VSG, mini VSG, single incision sleeve, RNY bypass, mini bypass, DS, single anastomosis DS, which is SADI, or loop DS, which they call them loop DS, BPD DS, and loop DS. And also all the different revisions from VBG, all surgeries, bypasses, sleeve. We do all that. Even sometimes if we have to do a reversal because the patient is not doing well with the surgery, we do that too. And then endoscopic therapies like gastric balloon, which I mentioned, we have Orbera and SPATS-3, which recently got approved by FDA in US as well. And ESG, which is endoscopic sleeve gastrectomy, and which is like a endo sleeve, and revision of the pouch if you need a bypass revision, which we call TOR. I'm getting to a point that Dr. Montalvo is going to take over. He is a scholar, well-educated, well-experienced, board-certified surgeon that we have, highly regarded. He has one of the lowest complication rates ever. And basically, I'm going to let Dr. Montalvo talk about himself if he likes, and take over explaining all different types of surgery we offer. Thank you, Dr. Montalvo. You're muted.
Hi, hello everyone. Thanks, Ron. I'm glad to be here with you. All right, let's start to talk about all the procedures that we have on our company. The gastric sleeve surgery is one of the most common procedures in the worldwide. So here in the gastric sleeve, we remove the 80 or 85% to the stomach using 1 to 5 tiny incisions. This is via laparoscopic procedure, and this utilizes the restriction to limit the food intake, change the gut hormones that cause hunger and satiety, and slow the gastric emptying. How this function? We're going to remove approximately, it's like the 80% of the stomach. This is a restricted procedure. This restricted procedure means that you're going to eat less portions, but you're going to eat normally foods, but less portions. The expectations, obviously, with the decreased levels of ghrelin, you're going to have less hunger and more satiety. And with this, increase the levels of PJYY, and no changes in the uh, ghrelin insulin protein. The pros can be easily revised if needed. How this works, because if in the future uh, you want to continue losing more weight, or you will need a revision, you have another uh, option of surgeries like bypass, a mini bypass, or dental switch. And the high amount of excess waste is comparable to gastric bypass. The difference is like 1% of the weight loss, and no changes to anatomy and less malabsorptions. This means that we're not going to change your uh, gastrointestinal transit. Uh, and there's the difference with the bypass. With the bypass, we're going to make some connections. Here in the sleeve surgery, no, we only remove a part of the stomach, but all the intestinal transit will be the same. So uh, at, with this is not going to be malabsorptions. So all the nutrients are going to continue absorb, and it's a short recovery time. It depends what kind of activity you do. The cons can be can worsen pre-existing acid reflux or GERD. So it's very important, if you suffer from this, uh, how severe is your reflux. It's a non-reversible procedure, and the average 1 year excess weight loss is 72% approximately. Uh, the duration is like 1 hour. You will be at hospital 2 nights, and the recovery will take 1 to 3 weeks. Obviously, it will depend what do you do. The next is a single incision gastric sleeve. The single incision, here the operation or the surgery will be performed through one opening roughly 1.5 inches proximally wide in the umbilical area. There's a hidden scar at the belly button, so the abdominal looks scarless free, and any tubes can be removed. The expectation is the same like the previous procedure, the classic BSG, and the pros is here only the aesthetic. It's a fast recovery, and the cons here is very important, the BMI. The the BMI obviously need to be low, less of 40, and uh, more the duration will take a little more from the classic BAG, like one hour and a half. It will take the 2 nights as hospital, and the recovery from 1 to 3 weeks. It will depend what do you do at work. Okay, here with the endoscopic gastric sleeve surgery. Here, a smaller stomach is performed by holding the stomach to create a banana-shaped tube. This procedure utilizes restriction to limit how much the patient can eat at a time. Here, the surgeon put a tube inside your mouth through your stomach. There's is the video and the suture, and there's scarless. Here, hold less food and decrease food intake, lower amount of excess weight loss. Not well suited for patients with gastrointestinal bleeding, large hiatal hernia, or previous abdominal surgery. So this is why it's very important, if you have a previous surgery or abdominal surgery, to put all this information on your HQ. The pros, this kind of procedure is reversible, obviously in certain conditions, reduce complication rate, no incisions or removing tubes, and the recovery obviously is short. The cons can be a potential risk of partial openings at the stomach pouch, and a potential risk of ulcers. Here in this kind of procedure, we don't remove any kind of the stomach. We don't cut or take out any part of the stomach. There's only internal suture. So the average at 1 year of excess weight loss will be 40%. The duration of the procedure will take like 30 minutes, 1 night at hospital and 1 night at recovery. All right. the RY classic bypass surgery. This is the classic bypass or the oldest bypass or the more common bypass. And here is we need to form a new stomach pouch while remaining the stomach stay in the place. The small intestine are reroute to a bypass through digestions, which create malabsorption and reduce calories intake. What this means, we're going to make a pouch of your stomach and make a connection to the small bowel. We're going to exclude approximately like 2 meters of your small bowel, and that is not going to function anymore. They're not going to absorb that 2 meters. So that's how you're going to weight loss, to lose weight. Obviously, not absorbing all the nutrients. The expectation here is only slight decrease in ghrelin, increase the levels of GLP-1, increase the levels of PYY, and GIP will decrease, especially in diabetic patients. This is very important with these kind of patients. Was or it's still like the gold standard, but in recent studies, we saw that the weight loss is the almost the same in all the weight loss procedure. The difference is like 1%. So this improves obesity related comorbidities like diabetes, high blood pressure, sleep apnea. Obviously, all this related for the overweight. The CANS is a change of vomit and dumping syndrome. This is very common in this kind of procedure, the dumping syndrome, and higher risk of ulcers. The average at 1 year of excess weight loss will be 75%, and the duration of this kind of procedure take like 2 hours. You will be at hospital 3 nights, and the recovery from 2 to 4 weeks. Obviously, it depends on what kind of what do you do at work. The best surgery for the patient. This will be depend of all the what all your data at your HQ. Obviously, if your BMI is not too high, you don't have any medical conditions, you don't have severe reflux, it's your first bariatric procedure, uh, obviously a gastric sleeve will be the best for this kind of patients. If you have a previous uh, gastric sleeve, if you have uh, severe reflux, if you have um, previous altered anatomy, um, this will take it will be better for a bypass or ROY or mini bypass. It'll depend. It depends. This is why it's very important to put all the information on your HQ. The mini bypass, or also called OAGB or one anastomosis gastric bypass. Here's the device, the upper portion of the stomach to a tube like a pouch. This will hold 4 to 6 ounces of food. So the like if you see in this picture, the intestine is looped to connect with the new stomach, decrease the amount of calories that you absorb. Here we exclude 2 meters of the small bowel and make the connection to the gastric pouch. Here the expectations are the same with the previous classic bypass. Is reduce the feeling of hunger, early satiety or feeling full after small portions, reduce the calories and nutrients absorbed. This is how this function, all the bypass, and resolves like diabetes, hypertension, cholesterol, and more kind of comorbidities. The pros is only a single anastomosis connection to the intestine. This connection is the same that we do at the RNY, at the classic bypass. This is why the weight loss on both of them will be the same. It's a safe, effective, and shorter procedure than a standard RNY, and is one of the most effective surgeries to reverse failed gastric sleeve lab band. The cause can be change of vomit and dumping syndrome, higher risk of ulcers, and change of bile reflux. And the average of 1 year of excessive weight loss will be approximately like 75, 76%. The duration, it will take 2 hours. The hospital night 3 nights, and recovery 2 to 4 weeks. So, how we choose, or how the patients can be, which one of the bypass will be the best for them. So again, it will depend on what information you or medical conditions you have. You have a severe reflux, you have a previous uh, mini gastric bypass, previous gastric sleeve, your BMI, um, how kind of diabetes, hypertension, previous gastric surgeries. It will depend, but the weight loss in both of them will be the same. Obviously, you suffer from severe reflux. The best for this kind of patient will be the gastric bypass or the classic bypass. All right, the next, please. All right, talking about the switch, the duodenal switch, this kind of surgery for weight loss is one of the biggest uh, surgeries. Why? Because here in this kind of procedure, we need to make more connections. Obviously, they will take more time of surgery, and the risk can be a little higher. So uh, this is also known like biliopancreatic diversion with duodenal switch. Obviously, it's a powerful weight loss and metabolic surgery. The expectation with this kind of procedure, the patient lose between 50 and 80% of excess weight in the first years. High percentage of the duodenal switch with type 2 diabetes are cured after surgery, and the malnutrition is a problem with this kind of patient. Why? Obviously, uh, because all of these connections, you will need to take all your protein, your vitamins, medical control. The pros, obviously, is 80% of excess weight loss in the first year. The stomach is reduced, highest metabolic effect, and highest expect of weight loss. So the cons is extremely strict vitamins required for life and higher risk than other bariatric procedures. Why? Because more connections, more anesthesia, and more time of surgery. The average at 1 year of excess weight loss will be like 80%, and the duration is from 3 to 4 hours. 3 nights at hospital, and the recovery. This is one of the uh, most will take more longer to recovery. 3 to 6 weeks. Obviously, depend what do you do at work. All right, how fast can the patient return to work after a bariatric surgery? It will depend. It will depend of what do you do. If you are sitting at office, no lifting, relaxed, it will take 1 to 2 weeks with the gastric bypass or a mini bypass. But with a duodenal switch, it will take 3 to 4 weeks. If you are just walking stand with 2 weeks, uh, fast pace 2 to 4 weeks, and lifting uh, 4 to 8 weeks. It depends too of how many weight you lift. Some patients have a little baby. It's no problem with any you're sitting. Here the we recommend to take care not to the baby don't hit your abdominal cavity so you don't get hurt. The recommendations here are at our hospital is the universal uh, measures like wear a mask, the social distancing, test prior to your travel, and the vaccination is optional. All right. Here, Ron is going to take here about the all the this kind of
Yeah, thank you so much,
financial.
Dr. Montalvo, for taking time explaining the main procedures that we offer. At this point, we like to have one of our affiliates talk a few minutes and share her stories. Let me see if I can. There we go. Jimmy, if you hear me, I opened up the speaker for you.
Hi, Ron, I'm here.
Hello, hi.
How are you? I don't know if anyone can see me though, so let
No,
me see.
yeah, I think we just have your voice. So go ahead.
Okay, perfect. Hi, everybody. Thanks for joining today. My name is Jamie. I'm a patient coordinator here with Mexico Bariatric Center, and I'm really happy to watch this webinar, but all of them. But Dr. Montalvo was my doctor. There will be a little bio about myself in the comment section. Marketing is kind of working on that at this point to get that in there so you guys can read up a little bit about me. But Dr. Montalvo was my doctor. I had surgery 2 years ago. I've lost over 130 pounds. I'm still losing weight with inches, and the program is really designed to set you guys up for a better eating habits, as well as the tools it gives you by removing the ghrelin hormone and also resetting that metabolism. At my age, that's kind of what I needed. And I had tried everything that didn't work for me. And I was on a lot of medications due to arthritis and fibromyalgia. And it caused me to gain the weight that I had put on. And thankfully, I've been without that weight for 2 years, and I owe everything to Mexico Bariatric Center. I'm now a work for this company, and I stand behind it 110% with the knowledge of being able to meet these doctors. And we do these lives a lot with them, with just the staff. So we get to know them, and I'm really thankful how my life has changed and how much it's changed in a lot of aspects. They talk about how your attitude and your outlook on life changes. It really does. And just the opportunity to be able to eat healthier and have that tool has been wonderful. And so thanks, Dr. Montalvo and Ron, for all your support, and the whole staff. Before I worked for this company, I still have the support of our nutritionists and everything all the time. So you are with us for life. Once you leave Mexico Bariatric Center, we're not done with you. We're here for you for the rest of your life to help complete a care plan with you.
Awesome. Thank you. Congratulations for your success and support and working with us day in, day out to help others to do the same, life-changing procedures.
I
Thank
wouldn't
you.
change it for a second. Thanks for having me today, you guys. And to all those people thinking and considering about surgery today, I really hope that if you ever need anyone to talk to, all of our coordinators are always here to support you and help you get you to Mexico to get this surgery. We're always here for you. We're all past patients as well.
Thank you so much. Thank you.
Thank you, Ron. Have a great day.
Okay. Okay, so we just continue real quick, go over the rest of the slides. Financing, if you need financing, probably the best thing to do is to reach out to your bank if you have good relationship with them, credit unions, and other options that we work with, e-financing, United Medical Credit. For Canadians, we use Medicard. And Super Money is kind of like a platform of several lenders like SoFi and Bank of America. You can reach out individually as a personal loan for SoFi, Best Egg, Lending Tree, all those are available. Just one hint is not to apply for more than one or two loans at the same time, because every time it hits your credit, then it will be harder to qualify. One of the benefits of going with us is you get a medical tourism complication coverage, which we call MTI, medical tourism insurance, at a very low cost. It's only $149 for peace of mind that covers your any additional medical surgical treatment if there is a complication, if there is a travel disruption, all that stuff is covered up to $25,000. And 45 days after your procedure, still, when you come to US, you still have that coverage. It is essential for bariatric patients to take bariatric vitamins because these are specifically made with high quality ingredients for bariatric patients. And when you do sleeve, for example, you need to do at least 1.5 years of taking these stuff. And again, you still need B12, you still need iron, but this is your multivitamins. It comes in a soft chew, chewable, drinkable, and capsules. And we talked about our packages up here. Let me see if it was mentioned there. Sorry, I have to go back to, there we go. So we talked about what our packages include. One of the latest addition to that is that we giving a month of free vitamins, and you get an email after your procedure, you get a nice package sent to you, and that's what is additional benefits of going with us. Is the free vitamins. And oh, that's right here. I'm sorry, the slide was right there. So this is what we call MBC care package. And basically this is what you're gonna get in the mail. So we send you a month of free coupon. You go online on Emerge Bariatrics, you order that, it gets shipped to you. Okay, so we getting to Q&A session, and we're going to start answering your question. One that I see was asked a couple of times, and it's pretty much asked every time, is PCOS. Is surgery good for PCOS, patients who have PCOS problem?
All right. Well, here with patients, obviously all these problems are related more for patients with excess weight, overweight. When you go to or take your bariatric procedure, obviously all your excess of weight is go away, and all your hormones go to normality again. So your hormones start functioning normally, and patients with PCOS, it can be better controlled. Obviously, you need to go to your gynecological professional and to continue all this. But obviously, in 85%, 90% of these patients, it will be better control.
Okay, so perfect, thank you. Okay, so they're asking, is there a best time to get the surgery? Best time is tomorrow if you have the pre-op diet done. The sooner the better. I mean, you want to take control of your life and renew
Exactly. As soon as better.
Yes. Why wait? So they're asking, do I need to go back to Mexico for checkup. So basically, all you have to do for maintenance is to do blood test. Maybe the first 3 months, after first 3 months, just go with your primary care physician, get a pre-op done. I mean, a blood test done to make sure that your vitals are good, your vitamin levels are good. Again, take the vitamins. We talked about, the bariatric vitamins. You probably need at least the first 5 years for bypass, and DS probably lifetime to be on the bariatric vitamins. And we have another one, which is specifically for bypass and DS, but I don't have the picture. We will present that to you. Yeah, so they're asking what negative consequence. Oh, another thing, not talking about blood tests. It's a great idea to do a blood test before you come to Mexico. Because especially for revisional surgeries, because once you have a surgery, especially bypass, you may have hemoglobin deficiency. You need to have your iron level checked. So do a blood test before you come. That doesn't mean we're not going to do our own blood test when you arrive, but that just to make sure your blood test is good. So when you come to Mexico, we don't have to add blood to you or postpone your surgery or have all those problems. That is a great idea to do. So they're asking Dr. Montalvo, what negative consequences could happen after ESG in a month or a year?
Well, consequences, not really like risk consequences. Here with the ESG, obviously, the limit or the life of this kind of surgeries 18 months, because it's the endoscopic sleep. Obviously, here we don't remove any portion of the stomach, so the sutures can broke, and the stomach again be normal, and you can regain that weight. That can be the problem, or an intern bleeding because our intern stitches. But that can be the more risk or problem with this kind of procedure. And the other restriction is that is for if you don't need to lose too much weight. That's it.
Okay. There are some questions about the price of a ESG versus VSG, which is regular gastric sleep. So basically, ESG is more expensive, and the reason is the supply. It's more expensive, and just because we buy it from US, and it's just more expensive. Yeah, so ESG is about $1,000 more than VSG, a little bit more than $1,000.
Before I forgot, other pre-op labs at home can be patients with taking blood thinners, or patients with thyroid or kidney problems. It will be better if you can make your labs and send it to us so we can check it, to prevent that you come and it can be your surgery postponed. These kind of patients.
Another thing I forgot to mention about pre-op diet is if you are on Ozempic-like injections or medication, semaglutide, we need you to stop that medication at least 2-3 weeks prior to the surgery, because these type of medications slow down your food traveling through your stomach, and when you do your pre-op diet, is not going to work. So you have food in your stomach when they do the surgery. They're asking, when is Dr. Valenzuela's raffle? So this webinar actually was supposed to be with Dr. V, and it was scheduled that way. Dr. V had unfortunate medical issue with her dad, and we had to ask Dr. Montalvo, and he was a sport, and he just accepted to cover for Dr. V. So we don't know what Dr. V probably would be the next or the one after next. Depends on how things go. They're asking, do you need passport? We highly recommend a passport book or a passport card. And when you're crossing the border, it's a peace of mind again. You want to make sure you don't get stuck in the secondary and the whole van misses their flight. When is the hospital open? Okay, so we have been, doing our best to do this as soon as possible, but there are so many components that has to go with opening the hospital. We are thinking June, but again, I cannot promise you because there are so many logistics that has to happen and come together. So they're asking if I was approved for sleeve and I have trouble following the diet, should I get mini bypass instead of sleep?
No. Well, here the most important, obviously, the procedure or the surgery, it's a tool. It's a very important tool to weight loss. But if you have problems to follow a diet, if that you're not conscious that you will need to change your lifestyle. So if you the weight loss in all of them are the same. But if you don't follow a good plan nutrition, if you don't make any uh, activity plan or exercise, you're not going to have or lose all the weight that you want. So this is why it's very important uh, to put in your head that you need to change your lifestyle. You need to eat more healthy. You need to follow a nutrition plan, and you need to make any kind of activity. Even if you have bypass, mini bypass, duodenal switch, gastric sleeve, you're not going to it's not going to function for you. You need to follow all these instructions.
So they're asking, I had a hysterectomy last year, but I still have a ton of symptoms. The big one is excess facial hair. Will losing the weight help with that situation?
Hysterectomy?
Yes.
Oh, where is
Oh, so this patient had hysterectomy, but she still has some symptoms like facial hair. They're asking,
well, that is hormone problems. This is hormone problems, not related with weight loss or a gastric procedure. This is more that you need to go with the endocrinologist or your gynecologist.
So Cassandra is asking, reflux is under control, almost gone, but when I had lap band, it was miserable. Also, type 2 diabetic in the last year. I've been looking for bypass. I've been recommended the sleeve several times.
Okay, the lap band first. The lap band is already out, and because that can be the problem of you continue with the reflux. And the good the two are good options for you. It will depend on what kind of other medical conditions you have, but both of them are great options. When we make the revision from a patient who has lap band, we uh, cut like a string on the gastric pouch, and that release the the depression of the stomach, and the reflux go away.
People with low platelet count and currently on medication for this, what would be the platelet range for do this to be able to get the surgery?
All right. In general, you need one 100 thousand platelets, so you can go in without complications. And if you are taking medication, the best will be your hematologist validation that you're under control and you have no problems to go the to take the surgery.
Yeah, so okay, so what procedure is seen with more revision done? Bypass, are there more on bypass or sleep? I'm not sure what they're asking. So what's a gastric bypass revision?
Okay, the bypass revision, we need to check the pouch, we need to check the connections, we need to check the how many length they take, how many the small bowel they uh, they avoid, at what the measure of the connections. That's why it's called a revision. We need to check all these connections in these kind of surgeries. And obviously we need to check if we can do something, the most important.
Um, so can you talk about common hair loss after surgery and what vitamins can take or what they need to do?
This kind of problems is more with for patients with a bypass. Why? Because obviously you're not going to absorb all the nutrients, the folic acid, the vitamins, the proteins. So if you don't follow a restriction, a nutrition plan, if you don't take your proteins, your minerals, your vitamins, obviously you're going to have some changes on your hair, on your skin. Uh, so it's very important with this more with these patients with bypass to take your vitamins, your proteins, your minerals, and have a nutrition plan. Take the calories that you need, and to follow the uh, your following with your primary physician, so he can take your general labs, so you can prevent anemia or iron deficiency.
I have sleep apnea. Will getting sleep help me?
Yes, obviously, this is related with the overweight, and in most of the patients go away the sleep apnea.
So what's the best option for a sleeve revision? Bypass or mini bypass or DS?
Well, it depends. It depends what kind of why. First, why do you want the revision? And the other one, if you only want to continue losing weight, uh, a, a, a bypass will be a best option. If you have other conditions, medical conditions, we need to evaluate. So if you're candidate for a DS or dual switch, but both bypass, the weight loss will be the same. It will depend on what medical conditions you have.
So they're asking about skin removal. We do have,
Yes, we recommend after 18 to 24 months, so you can schedule a plastic surgery, because it's when you're going to lose more weight the first months.
yes. And for this, you can come to our sister company, which is called MexicoCosmeticCenter.com. I typed it in the respond. And we work with not only board certified plastic surgeons, these are the surgeons who are expertise in post-bariatric patients. Post-bariatric patients are considered a constructive surgery because their skin, their body, their is different from just a person who's hasn't had surgery, and they need to have a surgeon that is expert in those type of surgeon patients. And that's why we offer MexicoCosmeticsCenter.com. And you can go online and do a health questionnaire, and we would be running it by the surgeon, get what's best for you. So they're asking about what would we do if you have complication in Mexico, if you have complication in US. So as I said, our complication rates are extremely low, but once you're in Mexico, you're under our surveillance. So if something happens, we take right away, we take action. Coming back to US, you need to comply with all the post-op diet, all the restrictions we put on physical activity. Let's say you're flying, and please make sure you don't lift heavy suitcase. Actually, you don't want to be bringing heavy suitcase, because the weather in San Diego is usually very moderate. And so you don't need to bring a lot of stuff with you. And the suitcase, don't pick up heavy suitcase and put it in the compartment above the seats in the plane. Take caution by wearing compression socks. Don't sit down for a long time. If you're driving, especially, just walk around every hour, get up and walk around, stay active. So these are the things. And then the diet, you want to be more complying with the diet, which is 4 weeks of going from liquid to solid. These are the things you need to do for proper recovery. Take the vitamin after the 2 weeks period after surgery. So if you comply with all these, you probably won't have any complication. If you do, it's very rare, but you probably need to right away go to the emergency room or take care of it, talk to us, see what the complications are. And the MTI, which is the medical tourism insurance, is going to help you to cover the cost. So they're asking, what is the importance of stopping smoking after and before surgery? Smoking, stop smoking after before surgery.
All right, if you're a smoker, we recommend to stop doing it 2 to 3 weeks before your procedure. Why? Because this is related with complications or of with your how do you heal with thrombosis, with blood clots and bleedings. So and the most important is that you're going to be under general anesthesia. The anesthesiologist is going to put a tube inside your lungs, and if you have some smoke inside, you're going to have it can be more difficult you to wake up or have a complication after the procedure. So we recommend from 3 weeks before the procedure, and after that, obviously you're healing your gastric procedure healing. So to prevent that too, we recommend not to stop. And this is a lifestyle change uh, changes. So if you're going to through this taking this procedures, we recommend to try to leave it first.
Joe is asking that he is scheduled to have surgery with you on June 17th. In the past, he had gallbladder removal, appendices removed, and invasive liposuction abdominal hernia repair. Is a higher risk or complication during my surgery?
No, a lot of patients who come with us have this kind of procedure. So no, it's it we work in another side of the anatomy of your previous surgeries.
They're asking about, is there like, do patients experience constipation?
They can experience some constipation. That's why it's very important to keep hydrated most the first days. Patients with bypass can be the opposite, because obviously the food not going to go through that 2 meters, so they can be more frequent to go to the bathroom. There can be some gastrointestinal changes when you have an abdominal surgery.
Can rapid weight loss lead to pancreatitis? Pancreatitis.
Let me read it.
Rapid weight loss to pancreatitis.
Uh, well, not strictly. It's very rare. Uh, but maybe there's some another medical conditions that your physician need to check more closely in this kind of patients, like gallstones or with uh, high level of lipids. It depends.
Okay, so we still have
Mm-hmm.
we still have quite a bit of question unanswered. we pretty much did all the main ones that I saw. It's medical. So, so that's actually a good one. Maybe you can answer this one. What additional mental health information is recommended for experiencing drastic weight loss?
What additional mental health?
Yes.
Well, if you can't go with a psychological evaluation or psychiatrics, because you're going to to take a big step doing this. All uh, your normal habits need to change. You're going to change your nutrition, your diet. You will need to change your habits. So all that need to be on your head, on your uh, mental. So if you can have that help, you can go through a psychological evaluation will be better, because this will help you to go through all these steps that you will need to take. But first of all is that you want to make this change.
Yeah, I'm still. What happens if I drink too much water at one time?
Well, uh, you can throw up. You can throw up in the first days. Why? Because you're going to have a small pouch or the sleeve. So obviously all this is going to restrict that all your intake. So uh, you will need to take a lot of water, but in small sips. All right, because it's very important to keep hydrated the first days to prevent, because this is the hydration is one of the most common complications uh, in the first days, because patients don't take all the water or the liquid that they need, and it's one of the most common. They go to the ER.
Okay, so yeah, I mean, again, we have about over 50 questions unanswered. Well, I think we got the main ones. The rest are asking about.
Hmm.
Um, Michelle saying she was on Saxenda and she got pancreatitis. So that's, again, these medications. So what happens with medications is, well, is first they claim this is all safe, and then they sell it, they make the money, they make their billions, and then after a few years, they come back and say, oh, by the way, there was some side effects that we didn't know about. Um, you know, they did it, for example, with Prevacid, I used to take Prevacid, and at the time they said, oh, there is no problem. And then they came back and said, oh, it can cause dementia. It can be doing your kidney. So they're doing the same thing probably to these Ozempic, Saxenda, all these other ones. They just crowding the market. It's promoting it on TikTok and social media and make it look great. I mean, I'm not saying, it works for some people, but for long-term putting it in your body more than a year, it's questionable, you know. Yeah, so why not get the natural way? I mean, Dr. Montalvo talked about different hormones that gets changed when you do surgery. And then, so they're trying to do this, imitate all these hormones artificially to put in your body. So anyway, so we're getting to our raffle, and I want to do the raffle because we are going almost to 2 hours. Again, thank you so much, Dr. Montalvo, for taking time and replacing Dr. V, and also explaining all expertise and that you have. And and I'm at the point that I need to do the raffle. So we have everybody who did the health questionnaire and was present to the end. Just make sure that this surgery is for Dr. Montalvo. Even if you schedule for some other surgeon, we need to switch you. But then again, some procedures that they may offer that Dr. Montalvo cannot offer. So based on saying all that, I'm going to pull a name and see what that name is. Amanda Black. Amanda Black is, I'm going to look for you here to let you talk and share a few minutes with us. Just a moment. There we go. Amanda, I'm gonna open up so you can talk to us. You're muted, so you can unmute yourself and talk to us.
Hello.
Hi, how are you?
I'm
Tell us where you are, which state are you are, and tell us a little bit more about yourself. First of all, congratulations for being the winner of the raffle, but go ahead.
I'm from Paragould, Arkansas, and I'm 5'9", I'm 47, and I've been big all my life, and I really want this surgery.
Great. Yeah, Dr. Montalvo would be more than happy. Have you been in contact with any of our coordinators?
Miss Jamie.
Okay, well, great. So you heard her talking. So
Yeah.
yeah, so it's the best match. Yeah, just she's gonna contact you, get you all on the calendar. And again, thank you so much for everyone attending our monthly webinar. We appreciate Dr. Montalvo's time, and we love to see you again. Thank you so much. Goodbye. Bye-bye.